anyway, here we go. So we're just going to talk a little bit about managing risk in a complex system, and just a way of sort of conceptualising risk in the way we might do it in resilient healthcare. So, and I'm going to contrast it a little with traditional models of risk management. So that's me, by the way, up on that thing in Norway. So risk management basically acknowledges that errors occur. It takes event probability, it multiplies it by the potential impact of that event, and tells you what the severity of that is and indicates what you should do about that risk. So essentially you're identifying it, you're analysing it, and then you're trying to control it. So many of you will have seen this type of grid before, where you look at the probability of an event across one axis, you look at the impact of an event across another, and then you end up in the grid somewhere that tells you what you should do about it, whether you need to do a lot about it or not. So just a little example for the afternoon. So if you want to think about, what's the risk of designing something for dropping an egg from 3 meters, or for the Americans from 1 yard, what's the probability of the breakage, and what's the potential impact of the event? So if you're going to get an egg and you're just going to drop it on the floor from about this high, what's the probability of breakage? Pretty high? Okay, and what's the potential impact? Right, so we immediately get into this issue of context. So it's where things like risk management fall down. So if you think about it from the point of view of the person who's dropping the egg, there's a very high probability that egg's going to just smash on the ground, and the impact's pretty minor, particularly if you've got a dozen or a couple of dozen of the eggs to play with. But what if you're the egg? You still have this very high probability that it's going to be smashed, and if you're the egg, that's pretty significant. So extensive management might be crucial to solve that problem. So we immediately run into this issue of thinking about not just the probability or the impact, but what is the context of that particular situation. To complicate things further, we've got patients in our system, and the patient view of risk can be quite different to the clinical view of risk, and quite different to the management view of risk. So the patient view of risk can depend on, what's been their past experience with healthcare, what are their fears and concerns, what are their preferences for their care. And so where patients are involved, that has to be factored in as well, and that's not something that you can easily put into a grid and multiply out. So the other aspect of patient view of risk is this thing of hazard versus outrage, which is that people perceive risk much higher often than the actual mathematical amount of risk. So if we look at some of these things here, say a terrorist attack, the big orangey red circle, the actual probability of that happening is very, very tiny, but the perception of it and the fear of it is really, really large and totally disproportionate. Similar with a plane crash. A lot of people are quite fearful of flying, but they're happy to take a taxi to the airport, and the chances of dying in the taxi are much greater. In the US, after 9/11, so many more people drove on the roads rather than taking aircraft because they were fearful, that the road toll went up by more than the number of people that died in the towers. And yet on the other end, you've got things like cancer. People think that's going to happen to someone else, so they don't necessarily have a high fear of that until it happens to either them or a member of their family. So that whole perception of risk can vary. It can vary on whether people feel things are fair or unfair, whether things are familiar or not familiar, whether they trust or don't trust the clinicians involved. So in a complex system, it's very hard to put a mathematical value on some of these things that then allows you to multiply it out and come up with a solution. So resilient healthcare, and this is one of the photos from Mary of some of the risk management they were doing during COVID when they were using simulation to try and solve some of the problems. In resilient healthcare, we're really looking about managing risk in a complex system. And what we're really looking at doing, actually probably the next one's better than this one to show that. What we're really looking at doing is we're trying to make sure we maintain that error margin. So risk management are all the things that you do to maintain that margin between where you're operating and that line that you're going to cross over and fall into some sort of adverse event. So the other complicating issue is that, you know, if you're managing an organisation or a healthcare organisation and looking at things like risk, there's often conflicts involved that you really don't have any control over. So, for example, in COVID, there's a conflict between risk to the patient and risk to the clinician. So, you know, you can't just look at, well, we want to do everything to keep the risk down for the patient, because some of those things are quite risky for the clinician as well. So there's a trade-off involved. The other thing with healthcare is the safety one view of healthcare is that we can get to this zero harm, that we can eliminate all risk and we can have zero harm. But in reality, there's always going to be these black swan events, so things that are just unanticipated, unknowable, very low probability, but very catastrophic when they happen. The other thing about trying to get to zero harm and eliminate risk completely in healthcare is really to do with innovation. So, so in healthcare, say we're trying to climb this mountain, and you've got some variability here. If you want to get consistently high performance, you can do that by reducing the variability. So it's the way Six Sigma works and some of those sort of processes is if you reduce the variability, you've got to maintain very consistent high performance. Now, that works very well in organisations that are static, controllable and knowable, because you know what your mountain is that you're going to climb. But healthcare looks more like this. You come to work each day and you don't know which of these hills you're going to climb. So if you've got a system that's optimised for one hill and then suddenly you've got to climb the other one, you'll find that you're at a big disadvantage, and you know your systems are just not going to be functional. So this is where we need to start thinking in terms of resilience thinking, and in terms of actually looking at diversity and variation and leveraging those so that we can climb whichever hill we have to face that day. So again, just back to this model, we're looking at trying to, in terms of risk, the key thing is this agility in the middle of being able to move between systems depending on what you find, to be able to manage the risk in the way that's most appropriate for that system. So this is just a study that we did in Australia, just looking at managing risk from an organisational level within a hospital. And there's a number of processes for doing it. So you've got quality assurance processes, you've got quality improvement processes, and quality and safety culture. And at the moment, we tend to look in two different areas for risk management. We look at accreditation, and we look at short notice accreditation. And even short notice accreditation is quite new. It's like an ad hoc where they just come in without notice. And they're really the only things we do. So we have this showcase activity that takes the hospital about 3 months to prepare, and then the short notice one, and we don't do anything else. But there's potential to actually manage risk in some of the other areas. So we could look, for example, at showcase areas in quality improvement. We could look at patient journey in quality improvement. We could look at showcase areas in quality and safety culture as well. And we tend to not look at the high-risk area at all. So when we're managing a risk in healthcare, we tend to just look at the everyday activity and not at the high risk. So we did a literature review looking at some of the inquiries in a number of different countries over the years, and we identified 15 major inquiries, and we looked at what were the factors that contributed to risk or contributed to those particular events happening. And we found that there were these 8 key things. So clinical governance processes, problems with leadership, problems with skilled staff, problems with monitoring, with performance, problems with culture, problems with teamwork, collaboration, communication, with patient involvement and coping with emerging conditions. And you can already see that those are a lot of issues that resilient healthcare considers, and that resilient healthcare has processes in place to try and work with. And in terms of care as usual or high risk activity, they sort of sat around there. So, so care as usual can cover quite a few of them, but we still need this additional type of risk management to look at high risk activity. And at the moment in most of our healthcare systems, certainly in Australia, we don't do that. The last one, just getting towards the end because this is a fairly dry topic, we need risk management systems that can learn and adapt, because our healthcare system's dynamic. And one of the studies we've done was looking at developing risk assessment tools for medical practitioners who are subject to malpractice. So what we did was we came up with some algorithms based on data, and you can put a machine learning process in place so that it can continually learn. So as you get more data, it can learn from it. We have potential to use AI like that for risk management in healthcare. And finally, the last thing is to implement a safety management system, which is really a framework of sets of tools and processes to help you manage risk. And those tools and processes can be both Safety 2 and Safety 1 type tools, so that you've got your toolbox that you can use depending on the problem that you have. The key, though, to remember is that you're actually managing the risk and you're not managing the process. Often safety organisations can get involved and get quite bogged down in actually managing the process rather than the risk itself. And a reminder of being dynamic, so you can't set and forget. And lastly, just a graph just showing you, or a table rather, showing you what some of the effective and ineffective aspects of safety management systems are. So that's it for me. Thank you.